Hi again. We're here today with Lucy Postolov, licensed acupuncturist and herbologist. We're going to talk a little bit about acupuncture and children. Hello, Lucy.
Hello.
Lucy, tell me, what ages of children have you seen in your practice?
The youngest child I ever seen in my practice was 3 weeks old. And his parents came to my office absolutely out of control because the baby would not stop screaming from the day he was born. And of course I go as far as teenagers.
I would imagine that children are a little bit nervous about acupuncture needles. Do you have any other methods that you might use to treat them?
Honestly, kids, when they come to my office, are not nervous at all because they don't know that I will treat them with needles, and very often I don't. If it is a very young kid, somewhere younger than 5, I'm not using needles. I'm using special gold 24-karat plated gold seeds. And I'm applying them just like that. I don't know if you even can see that little seed on my hand. And then I just get on the floor with them, get very comfortable, and we, what I call, place stickers. So I would put on the top of that seed a little sticker. And normally I'm going to start with myself, with mom, and the next you know, the child wants a sticker on his hand. So I place the acupressure 24-karat plated gold seeds on acupressure points. If it is a kid over 5 years old, I may use very thin needles. I don't know even if you're going to see it on a camera, but they are thinner than human hair. I don't know. I hope you will be able to see it. And when I put the needle, it's very quick, and the child practically doesn't feel any pain or fear. I also play with children with different crystals and apply them on different points. I use a lot of toys in the treatment, so it is more like a game interaction than really a treatment. I'm not wearing white coat, so they don't associate me with a medical doctor. And if it is a seed treatment, gold beads treatment, I usually just do it on the floor, sitting on nice, comfortable pillows with kids and moms. And if it is needles, of course, everything has to be sterile. Then we go to a treatment room. But again, we play game.
That's great, Lucy. What conditions do you seem to have the most common that children come in with?
I am usually making a joke that little children are just a little balls of snot, and they're usually, when they go first to kindergarten or to school, they always have running nose, sore throats, they bring infection to their parents, and they contaminate each other constantly. So I would say colds and flus and nasal upper respiratory issues are most common. Asthma is huge these days with kids. Allergies are a really curse of our century. So all these conditions are very successfully treated with acupuncture and Chinese herbs. And I have a special line of herbs which is designed for children only.
What about children who have trouble sleeping and waking up with night terrors, Lucy? Any help there?
Huge help, huge help. Another case I just had recently, a child went to Disneyland and was on one of the, what parents thought were a very benign ride, and yet the kid for 5 weeks would wake up every night seeing monsters. And for 5 weeks, parents didn't have normal sleep, and the mom was pregnant with the second child, and it became just a nightmare for the whole entire family, where everybody became sleep deprived. So again, I play my sticker games. I bought a really fuzzy, nice bunny for that little boy, and not that I'm playing a psychologist, but sometimes you need to bring different modalities into your work. In Chinese medicine, we believe in treating body, mind, and soul. So we agreed that this bunny will scare the monsters away, and that was the last night of nightmares.
Well, Lucy, I know that we've only touched upon the subject of acupuncture in kids, but I want to thank you for your time today. Any parting words for our listeners?
As always, be well and healthy.
Thank you.
Thank you.